Good afternoon, everyone. Thank you for joining us today. We are joined by Mark Barclay with 3RNet. Our office, the Oklahoma Office of Rural Health, pays the subscription for providers here in the state of Oklahoma to participate. And so, Mark today will be going over the program, the website, and answering any questions you might have. For the folks on the call, please feel free. You can unmute your own lines, put something in the chat. I'll be watching the chat. If you're watching this recording, please do not hesitate to reach out with any questions at all. And with that said, Mark, I'll turn it over to you.
All right, thanks, Laura. So thank you, everybody, for having me. My name is Mark Barkley. I am the Director of Member Services here at 3RNet. I am located in Grand Forks, North Dakota. So I've been with 3RNet for about 10 years. And before that, I served as kind of the coordinator for 3RNet in the state of North Dakota. So as Laura alluded to a little bit, the way that 3RNet works is we have one primary organization in every state. And so in Oklahoma, that is the State Office of Rural Health. And they basically run 3RNet for the entire state. So we provide them kind of administrator level access to 3RNet, and then they work individually with all of you as employers to grant you access to the website. So that's kind of what we're going to kind of cover today. So we're going to cover how to set up your account on 3RNet, how to apply, start posting your jobs, how to interact with the candidate referrals that you'll be receiving, and then also some educational resources that are available to you as well. So all of the resources that we're going to talk about today are covered by the Oklahoma State Office of Rural Health. So you will be able to create your account on 3RNet, post jobs, interact with all of those candidates at no charge. There's no charge for job postings or placements. Again, all of that is provided by our member there, or our organizational member there in Oklahoma, the State Office of Rural Health. So first and foremost, 3RNet.org is what we're looking at. 3RNet, we are a national nonprofit, so we've been around for almost 30 years. We're partially federally funded through the Federal Office of Rural Health Policy. And as I mentioned before, how we operate is we have one member in each state, and then that member works with the employers and also spreads the word to health professionals in the state and kind of serves as the facilitator between employers and those health professionals that are looking for careers. So just poking around a little bit on the public site, just to show you before we get into kind of the employer dashboard. So you can always come to the website and you can, look at your jobs here on the public site. You can search for jobs. Our latest jobs will always show up on the homepage here. So we'll cover a little bit of what that looks like. One point to note here. So if I open up our provider or profession and specialty list here, 3RNet is not just for clinical professionals. So we cover anything from administration to dentists, nursing, mental and behavioral health, front office, obviously primary care, physicians, specialists. So basically any type of professional that you're looking for within your hospital or health center or rural health clinic, you can use 3RNet to advertise those openings and connect with candidates. So if I search for our jobs here, you can see the interface that candidates use. So this is how candidates view the different opportunities on 3RNet. So currently there are over 10,000 active opportunities across the nation on 3RNet. So we will next kind of cover how you can get your account set up and start adding to that list with your own jobs and attracting candidates to your community. But just as a general kind of point of interest, again, this is how health professionals see your job. So keep in mind a few of these key fields. So what I'm highlighting here, this will be the job title. So you can see that certainly jumps out along with a little bit of the job description or the job kind of details here. So keep that in mind that when we get to actually looking at how to post a job, keep in mind this candidate view and kind of the different things they see, the different ways they can filter jobs, J1 visa eligible, telehealth, loan repayment, HPSA scores, etc. So if you are a new employer and you do not have a 3RNet account, the first thing that you have to do is register. So the easiest way to do that is just up in the top right under Register Employer. And I'll go ahead and throw that link in the chat box for everybody as well. But there's an application form. So you go to this employer registration form. You just fill out the information of the contact person and some information about the organization that you're working for. Under desired posting locations, of course, you want to indicate that you're interested in posting in Oklahoma. And then once you submit this, basically that will send an email to Pete and Laura and Corey there at the Oklahoma State Office of Rural Health. And that will be kind of their call to action to approve you as an employer. And once you're approved as an employer by the State Office of Rural Health there, you'll automatically receive an email from 3RNet to log in. And again, you can start posting your jobs and interacting with those health professionals. So first step, if you are not registered on 3RNet, if you do not have a current 3RNet employer account, just go to 3rnet.org, up in the top right, register employer, fill out this application form, click submit, and then that will go to the state office for approval. Once you are approved, you'll be able to log in. So there are kind of two different ways you can do this. So this is the public site, 3rnet.org. This is mostly meant for health professionals. You certainly can log in here by putting in the username and password that you set up when you create your account. But if you log in on the public site, basically it will just send you over to the employer dashboard anyway. So what I usually like to recommend to employers is just bookmarking the dashboard directly. So I'll also put this link in the chat. So the dashboard is where you're going to do all of your job posting and interacting with health professionals. So again, I'm going to go ahead and put that link in the chat. And I see there was a question from Kelly. Is there a way to verify if there's already an existing employer account for my employer? Yeah, Kelly, I will go ahead and throw in my email address here. I saw Pete just did that as well. But let me go ahead and throw in my email address. If you need anything at all related to the 3RNet website, just shoot me an email or give me a call anytime, and I can certainly look up and see if you have an account existing and reset the password for you if you need that as well. Okay, so once we've created our account or access our existing account, again, if we're on dashboard.3rnet.org, something that you might want to bookmark, you just put in your username, your password, click login, and then you are into the employer dashboard. So as I mentioned earlier, there are basically three different things that are provided to you as a service through the State Office of Rural Health there in Oklahoma that you'll be able to do on this dashboard. You'll be able to post any number of opportunities. So there's no limit of the number of active opportunities you can have on 3RNet, both clinical and non-clinical. Based upon those opportunities that you post, you'll be sent candidates that are interested in working in Oklahoma, and I'll explain that here in a little bit. And then we also have our resource center. So these are all educational resources related to recruiting in rural and underserved areas. So we all know that recruiting to an urban center is not the same as recruiting to a smaller, say, critical access hospital, rural health clinic. So we have all sorts of educational resources and templates and documents in here within the resource center that you'll be able to use as well. So first things first, posting opportunities. So once you're approved, you'll be able to freely post. So under job opportunities, you would just click add new opportunity. So there's kind of two steps to the job posting process. So the first thing we'll do is we'll show you all of the required fields in the system. So these are all of the required fields that you'll be able to include within your job posting. So a few to note, remember that job title. That's kind of the first thing that will grab that candidate's attention. So make sure you put some thought into that job title, maybe include some information of why somebody would want to work in your facility or your community. Another thing to note is profession. So again, all of those professions, there's over 300 choices here. So let's say we're posting for a primary care physician. We can just start typing in the name of the specialty or the profession that we're looking for. We can indicate it, but you can also cross-post easily as well. So when you're posting a new position, you can tag it as multiple professions. So let's say you're willing to consider family medicine, internal medicine, or pediatrics, for example. And this could be for NPs, PAs, mental behavioral health. Anytime there's some crossover between the type of professional that you're willing to consider, it's important that you cross-reference that for a few different reasons. So once you post your job, of course, it will go live to our website. So any health professional will be able to log in, search for that job, find it.
Why isn't this?
And interact with you that way. So that will be the first thing that happens is your job posting will go live to our website. Also, then the job will be emailed to the health professionals in our database that match your criteria. So if you were only to post it as family medicine, your job would only be email blasted to family medicine physicians in the state of Oklahoma. Whereas if you cross-post it as family medicine, internal medicine, and pediatrics, you'll reach all three of those professionals, again, with an interest in Oklahoma in our database. And then the third thing that happens, all of the referrals that you get, which is the next thing that we're going to talk about, all of the referrals that are sent to you by the State Office of Rural Health there in Oklahoma are going to be based upon the job openings that you have active. So Again, if you only have family medicine posted, you'll only receive referrals for family medicine physicians. Whereas if you have family medicine, internal medicine, pediatrics, you'll receive referrals for all three of those types of professionals. So it really is in your best interest to make sure that for any of those jobs that you have active, that you have those on 3RNet, because you'll both be reaching those candidates via their email inbox, and then also you'll be referred interested candidates right to your 3RNet account. A few other things to note here. So state, city, county, zip code, those are all pretty self-explanatory. Job details, remember that was another one of those fields that candidates see right away. So you might want to make sure that you, include some kind of attention-grabbing information within that job details section. You can add any sort of links or different information there. So you can have links to your own application process or however your internal system works. You can include all of that information here within your job posting. Over on the right-hand column, you'll see your HPSA score. So if you're not sure what your HPSA score is, you can use this link or, of course, get a hold of anybody there within the state office in Oklahoma, and they'd be able to help you out. And then down at the bottom, these are those filters that I showed you earlier. So are you willing to consider J-1 visa applicants? Are you interested? Is this a telehealth position? Or could you possibly support loan repayment? So those are all things. Since 3RNet is focused solely on rural and underserved employers and health professionals, a lot of the health professionals that come to our site are looking for some of those incentive programs like loan repayment, for example. So once you fill out all of the required fields, you have kind of two options. You can either click Save and Exit, and that will just post your job, send out that email blast, and you're kind of done. If you want to include more information, say about your community, about the employer itself, about any sort of compensation information that you want to share, just click Save and Add Detail, and that will bring you to an additional screen where you can enter more information. I'm on our actual site right now, so I'm not going to post this opportunity, but let me show you what some of those additional fields would look like, and then we'll stop and see if anybody has any questions. So let me go ahead and open one of these opportunities. One other thing to mention here, so right now I'm looking at all opportunities over in the left-hand column. So this will be a spot where you can view all of your opportunities. You can see how many times they've been viewed, etc. Also, then, if you want to quickly duplicate a job, under the Actions button here, there's an option called Post Similar. So let's say you post 3 jobs today, and then maybe next week you want to post another couple. If a lot of the information is similar to what you posted in those first 3 positions, you can simply use this Post Similar feature, and that will open you up a new job with all of the information ready to go for you, so you can simply kind of post it quickly and easily. So if I click Save and Add Detail, this will bring us into that additional screen where we can enter information about the employer. So, what's the employer's name that you're working with, an application link. You can include, obviously, your contact information will be pre-filled out based upon what you have on your account. But then you can also include additional information about your community and compensation and benefits as well. So just a quick recap before I open it up for any questions on what we've covered so far. Remember, first of all, you have to submit your registration form, and you do that on 3rnet.org under Register Employer. Once your employer account is approved by the state office there, you're able to add any number of job opportunities via the dashboard here, just by clicking Add New Opportunity. You can cross-post your jobs with different professions. And as I mentioned before, that will produce email blasts for you on your behalf, and then also will indicate which candidates are referred to you. And then you have 2 choices when you're posting a job. You can either just use the required fields, click Save and Exit, or if you want to include more information, which I would recommend, you can click Save and Add Detail. So let me pause there. Any questions either over audio right now or via the chat box? Okay, I see a comment in here. This is very exciting. Oh, great. Yeah, this is a service that, again, is completely offered to you at no charge through the State Office of Rural Health there. So you can utilize the platform in any way that you see fit. Okay, so we'll make sure we have other times for people to ask questions as well, but we'll kind of move on. I do see one other question. Can you have multiple users? So yes, you can approach that in 2 different ways. So if you have different departments, let's say you have a nursing department that just does nursing recruiting, and you have maybe a physician's department or something like that, you can have separate accounts. So since accounts are free to create and it's free to use, you can have as many accounts as you need to. So that's kind of example number one. Example number two would be, let's say there's 3 people within your organization that are all working with candidates and job postings, but you kind of share that. You can just create one general account and all share the same username and password and all access the system at the same time and everything. So basically, if you need separate job listings and separate candidates, you can create multiple accounts. If you just want to share everything, you can just have a common account and use the same username and password between the folks within your organization. So that was just a highlight of the job opportunities. So again, post any number of opportunities that you have within your organization. The second piece then is referrals, is what we call referrals. So only our primary member in each state, and Oklahoma, the State Office of Rural Health, has access to our candidate database. But they use that candidate database to refer candidates out to you. So the way that works is typically every Tuesday, you'll receive an email from 3RNet letting you know that you have new candidate referrals based upon the job openings that you have. And those candidates will be matched to you in 3 ways. So they'll be matched to you based upon the profession of the job postings you have active. So you'll only be referred candidates that match the profession and specialty of job openings that you have active. Second of all, the candidate has to be interested in working in Oklahoma. And then the third criteria is that candidate has to have been active in 3RNet within the last 7 days. So for a candidate that logs into 3RNet within the last 7 days, that would typically indicate that they're actively looking for a position. So every 7 days, you're going to be sent active candidate referrals that you can then view and interact with. And again, you can work with those folks within your own existing processes, and there are no placement fees or anything like that. We certainly do like to hear if you have success stories, because just like the State Office of Rural Health here in Oklahoma, we're also partially federally funded here at 3RNet. So as a kind of a grant-funded organization, it's certainly helpful to hear those success stories and help you guys kind of celebrate and recognize those. In the last fiscal year, so we do kind of a data tally every year. In the last fiscal year, we had about 3,300 placements across the nation using 3RNet. So 3,300 health professionals that found their position and were reported to us through 3RNet. So this system doesn't, or this account that I'm logged into doesn't have any active referrals because I just posted my job right now. But let me navigate over here and just to show you what that referral will look like. So this is our test site. The interface looks a little bit different here. So you guys are getting a little bit of a sneak peek of some additional improvements that we're working on. But when you receive a candidate referral, again, you will get that email notice that you have a new candidate referral. You'll be able to see the name of the candidate, their contact information, download their CV, and any sort of other pieces of information related to that candidate. One thing that I think is kind of cool, again, as a federally funded organization and a nonprofit, we partner with other organizations that are like us. So if any of you guys are familiar with AHECS, Area Health Education Centers, they are one of the kind of primary drivers of the pipeline across the country for rural and underserved health professionals. So we've partnered with the National AHEC organization that they are promoting 3RNet to all of their credentials. So health professionals can go through a process called AHEC Scholars, and that's kind of an additional amount of training in rural and underserved areas. And once they receive that credential through the National AHEC organization, they're prompted to register on 3RNet so that those candidates are filtering in right for you guys to be able to work with. So under SafetyNet credential, if you ever see AHEC Scholar, or we also partner with the National Association of Rural Health Clinics, NARC. They have their own clinical certification. You may see candidates that have those credentials. And again, those are candidates that have spent extra time in addition to their normal training to focus on rural and underserved areas. So again, you can contact these candidates and work with them any way that you see fit. Under the actions button here, you can see a couple different options. If you can skip candidates. So for example, if you received the same candidate a few times and it's just somebody that's not going to work for you, you can skip that candidate. You can view the full details about them and kind of do a few other things with those candidates under the actions button. One other piece of information to keep in mind. So you'll see that there's an expires tab up here. So a lot of the candidate referrals that you receive by the Oklahoma State Office of Rural Health there, they will expire after 7 days because we make referrals every Tuesday morning. Basically, Tuesday morning, I think the referrals are made about 6 o'clock Central Time, 6 a.m. that is. So you'll probably wake up to an email from 3RNet every Tuesday letting you know you have new referrals. And then, so if that happened this Tuesday, next Tuesday, those candidates will all expire and you would have a new list. So you basically have 7 days to kind of start working with those candidates and get them integrated into your process. If you see a dash under the expires column, that means the candidate has reached out to you directly. So when candidates are looking at our jobs on the public site, there's a way that they basically can refer themselves to you. And the email will look different when that happens. You'll get an email stating a candidate has inquired about your position. That means they've reached out themselves proactively. And then you'll see that there's no expiration date for that health professional. Okay, so we covered job postings, or first of all, registration, job postings, getting all of your jobs posted in any profession specialty. Based upon that, you will receive these matching candidate referrals that are interested in working in Oklahoma that match the profession specialty of the job postings you have active and have been interested or have been logged into 3RNet within the last 7 days. So let me stop there one more time. Any questions so far on anything that we've covered either via audio or the chat box? Okay, seeing none, just a few other points that I want to make before we kind of wrap up today, and we'll certainly give one more chance for any questions. So I'm going to go back to our normal account here, which is what you guys will see as soon as you register and create that account on 3RNet. As I mentioned before, the three primary things that you'd use your dashboard for are posting your opportunities, communicating with those candidates through the referral process, and then any of those educational resources that you may want to take advantage of, marketing, looking at your recruitment process, finding out what makes your community unique. So there are different, unique selling points or factors that draw people into working in rural and underserved areas. So we have different guides to kind of help you walk through and self-identify what draws people into your community. And then, of course, you can use those things in your job posting. So posting opportunities, accessing referrals, looking at our educational resources will be the three primary things that you use 3RNet for. And again, all of those things are provided to you at no cost through the State Office of Rural Health. One other caveat, just because if you're creating a new account, the first time that you log in, you'll see a little pop-up about what we call 3RNet Plus tools. This is a kind of an additional service that's offered directly through 3RNet. So that is a paid subscription service. It's totally optional. So you don't have to subscribe to 3RNet Plus tools to post your opportunities or work with candidates or access our educational resources. 3RNet Plus tools is mostly for organizations that maybe need a candidate tracking system. So there's a candidate tracking system built into 3RNet Plus tools. In 3RNet Plus tools, you can take your jobs on 3RNet and use them on your own website. And then there's a lot of kind of different data and reporting elements within 3RNet Plus tools. So again, just be aware when you see that little pop-up when you log in the first time telling you about 3RNet Plus tools. If those aren't services that you need, you can simply X out of that and kind of ignore 3RNet Plus tools over there in the left-hand column and still use all of those other things that we just talked about free of charge. If your organization does find value in 3RNet Plus tools, it's $750 a year, so it's a fairly low cost. And again, there are some additional things you can do within 3RNet Plus tools, especially related to candidate tracking, marketing, featuring your jobs on our website, those sorts of things. Okay, so I believe that is everything that I wanted to cover for the sake of today. Was there any other comments, questions, examples that anybody wanted to see before we get going here?
Hi, Mark. I'm not seeing anything come through the chat at this time. Thank you for your time today and also sharing your contact information. We are recording this session, and so once it is posted to YouTube, I'll be sure to share the link with everyone so you can refer back to it, share it with colleagues within your organization, or whatever. So with that said, Mark, thank you so much. Just one last chance if there's any questions or comments. All right. Thank you all for your time. Please do not hesitate to reach out if you have any questions or concerns. Thank you all.
Thanks.